The military factions who are at war in Sudan are far from ending their hostilities, but they've promised to minimize harm to civilians and to allow safe passage for medics and humanitarian relief. So far, the fighting has destroyed numerous medical facilities and forced many doctors and other health workers to flee. Those who can bear to remain are overwhelmed with patients. You might find parts of our next report disturbing.
For Ezra Hezbal Razul, the fighting in Khartoum brought utter devastation. Her twins had been born prematurely and were safe in an incubator. But then her maternity hospital came under attack.
When the bombs started falling at the hospital on April 20, we were told we had to evacuate because no one knew what would happen next. So we scrambled to rescue my two babies. There were no ambulances to transport them, and one died because of the lack of oxygen.
Khartoum's medical facilities have been shelled again and again in the weeks since the conflict began. Many medical workers have fled. The UN estimates only 16% of hospitals in the capital are still fully functional, and those which are still open lack everything: electricity, water, medication.
Our stocks of medicine are starting to dwindle. If it goes on like this, everything will collapse. A lot of people ask me for medicine, but I can't give it to them.
A month of fighting has meant a never-ending stream of severely wounded people. Hasahisa Hospital is 2 hours outside Khartoum. Dr. Hamza Kamal treats the injured here every day. Like this man, he was shot in the back.
I'm a surgeon here. Since the beginning of the fighting, we've received so many injured people here. Some of them have been shot in the leg, some of them in the hands, and some of them in the stomach. Some of them here survive, and some of them unfortunately don't. We receive between 3 and 5 patients every day. The most dangerous injuries are the gunshots to the stomach.
Another young man describes what happened when he ventured with relatives out into the streets, desperate to find food. Suddenly he was surrounded by gunfire and hit in the foot.
As I started moving forward, bullets were flying towards me, more than 150 bullets. I could hear the sounds. I was scared. I lay on the ground. We were 3 of us there, my father, my cousin and myself. We just gave up.
They'd been ambushed by the paramilitary Rapid Support Forces, who robbed him and his family of all their belongings, finally letting them go to the nearest hospital.
I saw the Rapid Support Forces looting inside the homes of civilians, but I managed to make it here safely, thank God.
Amid the fighting, hospitals where doctors like Hamza Kamal keep fearlessly working are one of the few places in Sudan where there's at least the hope of safety and refuge.
For more on this dire situation in Sudan, I'm pleased to welcome to DW News Africa Dr. Sohair El-Nil, a member of Sudan's Doctors for Human Rights, and she joins us now from London. Welcome to the program, Dr. El-Nil. Now, let's go back to this organization, the Sudan's Doctors for Human Rights, that you are affiliated with. You were part of sort of rallying people around the time of the revolution. What's the organization, or what's the collective doing at the moment with the war?
So the initial remit of the organisation was really to work with colleagues in the diaspora as well as on the ground to provide and ensure that access to healthcare was maintained and to support our colleagues there. As we have gotten into this crisis as of April, this has become increasingly difficult because many of our colleagues are unable to go to work simply because the healthcare facilities have been affected, significantly decimated. So we're continuing in our role in advocacy externally and internally, promoting policy and ensuring changes that can come into place to ensure that we can deliver that healthcare access to the people of Sudan.
And what are you hearing about how your colleagues in Sudan are coping? especially with the fighting and with the limited resources?
So it's affecting us on multiple levels. It's affecting us at institutional levels. It's affecting us at social, cultural, and of course at personal levels. So we are struggling hugely because the healthcare facilities have been decimated. Many healthcare institutions have been actually brought to the ground. There's been extensive looting of medical stores, medical equipment, even beds in the wards. There's certainly a huge lack of medication and healthcare supplies, and indeed multiple groups of healthcare personnel, not just doctors, but all levels, including our paramedics, nurses and midwives, have been affected and have been basically put in a situation where they cannot work.
Why would anyone be suspicious of doctors? Is it because of the role they played in the revolution, or is there more to it?
Yeah, I mean, I think this is a common problem we see all over the world. Doctors and nurses and healthcare professionals generally are always there at the port of call and need when a crisis or a war occurs. And therefore, their role goes from being a neutral role to that perceived by different parties as not being neutral. And therefore, they do become targeted to some extent. And equally, a lot of our brethren were involved with the 2019 revolution in trying to promote not just health and safety and access to care, but also to try and ensure that the people of Sudan got what they needed when they needed it, because we've always had a very fragile healthcare system, and it was quite important that the doctors stood up for ensuring that that healthcare system was sustained and maintained during that time.
And at the moment, what are most patients needing? What do they lack?
So we can go in so many directions. It's everything from very simple things like pain relief and antibiotics to diabetic medication, kidney medication. In particular, our patients who are going through dialysis, and then, you know, young people dying of asthma attacks, which is unheard of really, because there's no oxygen or medication to help with their asthmatic attacks. So it's everything that is what we would call our routine bread and butter of the work we do anyway as doctors. But on top of that, you've also got all the injuries and the trauma, but not having access to intravenous fluids or medication to help such patients, or even take them to an operating theatre to fix the problem that they may have.
How can Sudan's health workers be supported, bearing in mind the fighting is still going on? Some of the routes to even get to where they are in the line of fire. So how can, if the international community wanted to support them, how can they do so?
So, I mean, I think there's several factors. Obviously, we need the war to basically come to a halt, and it has to be stopped. We need safety guaranteed for all our healthcare workers and civilians, and we need to ensure that the corridors of peace are maintained and sustained and not breached, so that medications and other healthcare resources which are arriving at Port Sudan, for example, can get from Port Sudan to the places of need in places like Khartoum, Omdurman and Bahri, where the actual war is raging. So actually ensuring those corridors of peace are maintained, ensuring we can get transport, because at the moment even the access to fuel, water, electricity, etc. is not available. It's all of those things. It's the infrastructure has to be put in place, and the only way that can happen effectively is for the war to come to a stop.